Then they saw my ovaries were enlarged. I had numerous cysts in the ovaries. That explained the periods.
Having very, very heavy, painful periods. We're trying to help debunk so that we understand that no, that's not normal, and please come in as soon as you notice there's an issue.
Yeah. It took me almost 10 years to understand everything about my body, everything I'm facing.
Yeah.
Because it's not been easy, and especially for my mental health.
You're talking about learning on your own of something that is so complex that a lot of us doctors still are working towards understanding. And this is not just in Kenya, this is globally. Such conditions where for the longest time we used to be told this is normal. Yeah. This is normal, this is normal. Now we know it's not normal, but what is it if it's not normal? Yeah. Hi everyone, and welcome back to another episode of Circling the Rabbit Hole podcast with me, Dr. Claire Kinuthia. Before we start, I want to say a big thank you to our location partner, Ashley Furniture Home Store and Fair Deal Furniture, for hosting the podcast through season 4. Now, jumping straight into today's topic. Reproductive health issues, young women, and some of the struggles that we face, especially so to do with understanding your body when your body feels like it's your enemy. And today I'd want us to talk about something that I see a lot of false information on, and I understand it because it has, it's something we're trying to understand as doctors. So I understand when someone who's been given the diagnosis isn't able to fully comprehend, fully explain, even navigate the idea of what the condition is, and that's polycystic ovarian syndrome. A lot of young women come into clinic to talk to me about having been diagnosed with an ovarian cyst previously, or they've had issues with a chronic cyst situation, and that in itself tells us a lot in terms of understanding of any medical condition. An ovarian cyst can range from a normal cyst all the way through to polycystic ovarian disease or syndrome. And so just trying to navigate the nuances and help the audience today, those of you who are watching or listening, come to a better understanding and grasp of what this condition is, what it looks like, because it doesn't look the same for every single person, and also just generally speaking, how to navigate living with this diagnosis, because it is identified as a chronic illness or a lifelong diagnosis. Okay, so then to just help avert spreading further misinformation, I'd like to read through the World Health Organization definition of what polycystic ovarian syndrome is. That's PCOS. PCOS is a common hormonal condition that affects women of reproductive age. It usually starts during adolescence, but symptoms may fluctuate over time. PCOS can cause hormonal imbalances, irregular periods, excess androgen levels or testosterone levels, and cysts found within the ovaries. Irregular periods, usually with a lack of ovulation, can make it difficult to become pregnant or to conceive. PCOS is therefore a leading cause of infertility. It's considered a chronic condition and cannot be cured. However, some of the symptoms can be improved through lifestyle changes, medications, and fertility treatments. The cause of PCOS is still unknown, but women with a family history or themselves having a diagnosis of type 2 diabetes makes it a higher risk for them to have this condition. So with that, I'd like to introduce my guest today, or rather have my guest today introduce herself, because she's someone who's fully, intimately aware of what PCOS is. And so I'd like us to walk the journey with you to sort of understand what it looks like from the lens of someone living with this condition. So before I preempt and speak forever, first of all, thank you so much for being on set with me today. Please tell the audience who you are, what you do, and where we can find you on socials.
Thank you so much for having me here. I'm Nanjie Galgalo. You can find me on Instagram, Twitter, TikTok, Facebook as Nanjie Galgalo. I am a social media influencer and a content creator.
I'd like us to jump straight into understanding the journey so far. So I've already preempted and told the audience about polycystic ovarian syndrome. But when you first started off, before we get, because this is many years ago now, before we get to a point of understanding the condition you're living with, what was happening? What symptoms were you experiencing that you felt that something is wrong and I need to go see a doctor?
Okay, I was 15 at the time. I was in school. I had just moved school, so it was a new climate, new place, and everything. So I had my periods for the first time for a week first, and then I was like, okay, this is a bit normal because that has been happening.
Yeah.
Then the second week, then the third week.
So continuously.
And then a month.
Right.
So at first I thought maybe it's a weather thing, like maybe my hormones, maybe I'm just sad to be away from home. But now because I was in school then, so I went to the nurse and I explained everything. And she didn't understand what I was saying.
Right.
Like, what do you mean?
Yeah,
Your
what do you
periods
mean?
for a month.
Yeah.
So every single week I got new sanitary towels, and then at some point I had to call my dad. And I explained to him everything. So he came. The first thing he asked the nurse, why did you wait for a week to lapse? Because I don't think it's normal for a woman to have their periods for more than 5 days. Why did you wait?
Yeah.
So the nurse thought I had done some sort of abortion, so I was healing in school.
Right.
So my dad took me to the hospital. He was very worried, so I had an ultrasound first, which showed nothing, actually nothing. So he continued insisting there's something wrong because she can't have the periods for a month.
A month, yeah.
So I had a transvaginal scan done, which was very painful at that time because I was very young. Then they saw my ovaries were enlarged. I had numerous cysts in the ovaries. That explained the periods because I could get the periods like either a month or they disappear for like 6 months.
Yeah.
And then, of course, I'm okay with that because who likes getting their periods every month? So I never used to think that's a problem.
Yeah.
But now, then I realized, because the first time I got my periods, I was 12. It came once and disappeared for like 2 years. So I thought maybe this is normal. I didn't tell my mom. I didn't tell anyone.
Yeah.
So now when I got to the hospital, now explaining the whole thing to the doctor, now he was like, okay, why did you take so long? But I just didn't know because no one tells you.
Of course.
Yeah.
That's the thing.
Yeah.
Because it's part of the reason why this podcast exists is debunking myths and also normalizing conversations around our periods, our sexual reproductive health. Because one of the reasons why a lot of girls don't understand that something is off, if you get either an irregular period or a very prolonged period like what you're describing, bleeding for a month continuously, or having disruptions to your period. So some women will have a few days on, then nothing, then a few days, then nothing. And so they're not too sure what's normal, what's not normal, or having very, very heavy, painful periods. We're trying to help debunk so that we understand that, no, that's not normal. And please come in as soon as you notice there's an issue. Yeah.
Nothing about my periods has ever been normal, actually, because I think now when I sought treatment, I was on the 30-day pill, which now I think back was a bit early because it has been more than a decade of those meds because I have to regulate my period, so I have to be on those meds.
Yeah.
At first, it wasn't easy because, first of all, we relate to those meds as family planning.
Yes,
so I'm 15, I'm taking those meds.
Yeah.
The nurse is just
the nurse, first of all, who thinks you had just had an abortion.
Yeah, like
is now seeing you on the pill. Wow.
I'm coming for the pill every single day.
Yeah.
So at some point, there's a teacher who was really interested, like, what's going on? You went home for a while, what's going on? So I explained everything to her. And she's the one person who tried to understand and tried to teach everyone what's going on with me.
Okay.
Because I also didn't understand.
Yeah.
As much as they told me you have a lot of cysts, I'm like, can't you remove them? You're telling me
you're seeing a problem. Why are you leaving me with my problem?
Yeah, but I had to live with it. And it took me almost 10 years to understand everything about my body, everything I'm facing.
Yeah.
Because it's not been easy, and especially for my mental health, it's not been easy. Yeah.
So the starting point, did you receive a formal diagnosis, or were you just sent home with ukona cysts, take this pill?
I did. I did, because first of all, the first hospital, it was a clinic. So they just told me, your periods are irregular, take these pills. So my dad was like, apana, let's just hold off on that. So I went to another hospital. They did the same scans. So I've had the transvaginal scans done.
Right, multiple times. Yeah.
So finally they told me, you have what's called polycystic ovarian syndrome. They told me everything about the fertility and everything. And then they went back to the pills. They didn't explain anything past that.
Right, okay.
They were reading off the computer.
Right.
So I'm just listening. I'm like, yeah, I relate to that.
Yeah.
The irregular periods, I relate to everything you're saying.
Yeah.
But what can I do about it? You're not telling me what to do. So for, I think now until I joined college, then I just decided I need to go back to the hospital again. Because now every single month I buy these pills. Yes, I get my periods, but what's the long-term effect?
Yeah.
So now after college, now that's when I got like a good doctor. He didn't do the transvaginal scan, actually. He didn't even need to do it.
Yeah.
He just tested my hormones. And he was like, you have polycystic ovarian syndrome, right? Yeah, your hormones are... So what you can do... But now for him, he was leaning on, you need to have kids. At your age, you need to have kids.
Right.
I'm 20.
Yeah.
Don't tell me. I'm not like...
crazy though.
It was crazy because I've just joined school.
Yeah.
I've just started working.
Yeah.
No, this is not a solution for me now. I need something else.
Yeah.
So I was in and out of the sessions because you're not telling me anything. So I started reading more on my own, which has been easier on my end, because every single doctor I try and explain how I'm feeling, they'll tell me, they'll just give me a textbook definition or a response.
Yeah.
And I'll take it because I've paid for the consultation, so I'll take it.
Right, yeah.
But now the learning on my own has been easier on my end, because most doctors have not helped me.
Right.
And it's been okay.
Yeah. Because again, you're talking about learning on your own of something that is so complex that a lot of us doctors still are working towards understanding. And this is not just in Kenya, this is globally, because a lot of menstrual health issues and diagnoses that we're making, we're only just starting to understand them. That's polycystic ovarian syndrome, endometriosis, adenomyosis, such conditions where for the longest time we used to be told this is normal. This is normal. Now we know it's not normal, but what is it if it's not normal? So then just what you're describing, a cycle where we'll see a patient who's seen several doctors come in, and a lot of times I'll get the fourth or fifth recommendation, and down the road I'm having to undo so much because whoever they've seen before did pretty much just half, or because I don't fully understand, just take the pill and go. I'm not explaining why the pill is effective, what it's effective for, that the treatment, for example, for PCOS depends on your need at the time. It's not something we fix, one thing fix all. If the issue is endometrial protection by making sure you get your period every month, then probably being on hormonal management will give us the cycles. And then if you're thinking about fertility, of course, then I'm not going to continue on a contraceptive, essentially, because then now we need to switch over and focus on fertility management and deprioritize having a period, so to speak. And then long term, afterwards, do I continue with hormones, or now do I look for other options? Like what's the journey looking like? What will perimenopause and menopause look like? Will that affect me now, or is it something that will come up later? So we don't have enough of these conversations, I don't think. And so hearing you say you had to navigate it on your own, and I can imagine, how long ago was this? How many years?
13 years ago.
13 years. So I can imagine what the internet was then. So where are you learning? Because you see, if you put it in context of 2025, Google and you'll find an answer anywhere, and you'll find detailed explanations, and lots of papers have been written and research is ongoing. Back then
it was not helping anything,
right?
But I was young, so there's so many things I couldn't understand. And then now for the fertility part, it freaked me out at some point. But then I was young.
Yeah.
So I thought,
it's not a
I'll think
today
about it
issue.
later.
Yeah.
But now I learn better. Now it's easier to understand. I have friends who are doctors. I can ask.
Yeah.
Yeah. So now it's way easier.
Okay.
Hey, back then. Yeah.
Okay. You talked about the mental health aspect, the emotional aspect. When you first heard you have cysts in the ovaries, you have polycystic ovarian syndrome, what went through your mind? What was your first response?
I thought I would die. Yeah, because I've heard of people go through surgery because of removing like a cyst or two and they're good. So you're telling me I have many and there's nothing you can do about it.
Yeah.
It was scary. It was scary. And I think I just put the thought at the back of my head because at the time I didn't want to think about what's going on. But even till date, it's a bit scary because there's things I would want to do, like maybe having kids, but I have to think about it. There's so many treatments I need to go through. It was scary, it's still scary, but now I have things to read. I have people to ask. I have doctors to ask.
Right.
But at the point,
yeah,
I didn't think I would ever get past accepting. I think I never thought I'd ever accept. And then now it was a bit embarrassing to even tell people that I'm having my periods for a month. I have ovarian cysts. They can't be removed because everyone asks,
yeah,
can they be removed? I'm like, no.
yeah.
So what is this?
What is
then?
this? Yeah.
So it's a bit confusing for people, for me. So sometimes I never used to talk about it because now I have to explain to you everything.
Yeah.
I also
and again,
don't
it's
understand.
to do with your period. So there's already taboo there. Culturally, do we talk about our periods in public? You know, and again, I keep contextualizing. See, 2025. Now it's more common to even open your phone, be on our browser somewhere, and you'll find TikTok, YouTube, everywhere we're talking about all these conditions. But back then, it was a very different picture. So I can imagine now I ask you what's wrong. Why are you not functional? Why are you not engaging? Why are you not showing up the way I want you to show up? And how are you how are you explaining it to me in a way that I'll understand? Yeah.
For the first time, I think it became a bit easier to talk about because the one person I called was my dad. My dad was really supportive the whole time. He made everything easier to talk about because he was very invested. Every single time after a session, he asks me, what have you been told? How are you feeling? When I had my periods, he kept on asking, are you in pain? Do you need anything? Do you need... he even got me a hot water bottle.
I love that it's a man who's holding your hand through this journey that he has no understanding of.
Nothing.
Yeah.
My sisters, my brother, my mom, they all were very, very, very invested. But my dad, I think it felt different because I think in my head, I thought he's not supposed to be doing this. My mom can do it. She was doing it, but my dad was like, every single day, how are you feeling? Are you in any sort of pain? Even on a random day, I don't even have my periods. But he's like, are you feeling pain?
Oh.
I'm good.
That's so amazing.
So he made it easier to even talk about with my friends, male friends, even just anyone who'd ask me, like, do you have any illnesses if I'm trying to date someone? And I'd talk about it. So shout out to my dad.
So he helped take away the shame that you had been experiencing.
He actually did take away the shame because I never talked about it for a couple of months, even with my friends. Even after them asking what really is a problem, because we'd be hanging out and I'd take a moment to just go and take my pill and come back, or I just shut down. And they're like, what's going on with you? Like, something is off. Like, moods too. But now with time, because he made it very easy to talk to, I could talk to anyone about it.
Right. Okay. So now, literally, sad as it is to say, you have 13 years experience of living with PCOS. Like, it's something that we should be allowed to add on our CVs, living with a chronic condition. I'm like, hi, my name is Dr. Claire and I have endometriosis. And you need to put up with this XYZ and, prep.
That would be nice.
and employ. That would be amazing, no?
Very nice.
Maybe one day. But then with all the years of experience behind you, what's your current understanding of PCOS as a condition through your lens?
It's a fertility issue.
Mm-hmm.
It also is a mental issue.
Mm-hmm.
It affects everything about a person.
Mm-hmm.
My biggest issue is my mental health because I have been in the pits for years.
Right.
But it's not easy for anyone to tell because I just wake up and decide I want to show up.
Yeah.
But there's times I really cannot.
Mm-hmm.
And I call in sick at work and I'm like, I can't come today.
Mm-hmm.
So for me, it is more of a mental battle.
Okay.
Because physically, the symptoms I'm okay. I'm an age. If I'm in pain, I take medication.
Mm-hmm.
If my periods go for longer than 5 days, I go to the hospital. I get an injection.
Mm-hmm.
Physically, I can manage. It's a bit of a toll at the end because there's so many symptoms. Every single day, there's something new.
Something new.
Yeah.
That's the thing about
Like a
it.
month
It tends to
ago,
also evolve.
I realized I have hot flashes, heat flashes.
Mm-hmm. Right.
I never knew
like,
that.
what is this?
So physically, it's a discovery every single day.
Yeah.
But mentally, there's times I'm okay. But there's times I cannot.
Right.
Fertility, I'm not yet there to know if it's a problem or not. But I know it is a fertility issue. I understand that most people don't know about it. Most children don't. Most teenagers don't. And I think it's a problem because I know teenagers who have gone through this and their moms ask me,
yeah,
nini.
Yeah, exactly.
And I have to explain to them and their daughters, like, this is what's going on. I'm okay. I'm living with it. I'm fine. So when people see me, because I'm very up and down everywhere. So they see me and they're like, you have it, but you're okay. But you say you're struggling. I am. But I'm choosing to show up.
Exactly, yeah.
So as much as it is a very interesting and very difficult illness to live with, the mental part is really overlooked most of the times. And that's what I am trying every single day to understand with my therapist, with my psychiatrist. I'm really trying because they understand that even if I'm sad on my own, like maybe something is stressing me, I can be just sad, like I'm just seated here having a good time, and I'm just sad. And it's just my hormones. It's a hormonal roller coaster.
That's the thing. I think that's the thing people don't understand because it's easy to dismiss someone for, oh, she's having a mood swing, or she's in a funk, or that one is always grumpy, that one is always tired. The number of naps I need just to stay alive. Most people think I'm just exhausted all the time. I'm like, guys, it's like a power surge. I need to plug in kidogo, take a power nap, and then I'm back and I'm 100 again. But then it's easy to be dismissive of someone living with a chronic illness, like especially one that's invisible, so to speak, because PCOS, again, the challenge we have even as medics is the fact that no two women present the same. And as much as we talk about typical symptoms, so for example, acne, facial acne, male pattern baldness in women, chest hair distribution in a male pattern, so facial hair, chest hair, belly hair, those kind of changes to hair distribution, weight gain, excessive, being pre-diabetic or pre-hypertensive, sometimes actually ending up with hypertension and diabetes. What's the other one? The mental health challenges, the mood swings, then being brain fog, being unable to concentrate long enough or even remember what you can be in the middle of a task and then you go, shoop, lights off. And when you come back, you come back and you're like, I can't even remember. Let's keep it moving. So with all these typical textbook symptoms, what we forget is not you won't find the same 2 or 3 women who are experiencing the same symptoms. And so there are those who will have mild to nothing, but still have erratic periods here and there. There are those who will have the extreme textbook version of symptoms. And so navigating also that treatments will not be one size fits all also comes into play. So it's interesting to hear when you say that yours primarily is the mental health aspect that you're having to figure out and navigate, while at the same time, listen, because I've stalked you on socials. Because, I have to do my research and I'm like, okay, so I'm having Nanjie on set today. Let me see who she is and find out a little bit about how you're navigating life. And we don't see I may speak as your audience on social media. We don't see the struggle. We see somebody who's living her best life. Honestly, even me, I came out of there and I was like, first I need a holiday. I need to inject more fun into my own life. But then you seem to have it together. You know what I mean? You're not because we do see also there are people who struggle so much that their condition becomes their identity, so to speak, because you just don't know how else to navigate. I want to be able to talk up. Kuongea initoke. So there are those who land on your page or on your social media and all I see is the condition. All I see is information or explanations about my journey or the struggle I'm having at the moment. And so that's something that comes off as, okay, this one is suffering.
Yeah.
And then I land on Nanjie's page. The only thing that says PCOS is over there at the bio.
And my highlights.
That's it. And highlights. That's it. And so I'm like, okay, girl, okay, you've cracked the code. So then listening to you talk about it being a struggle is really interesting.
It is. And I think my audience, at this point, if you followed me for a long time, you understand I get to a point, I just tell people, I just can't.
Yeah.
If I'm working with a brand, I tell them I'm not in a good place
Right.
to work with you right now.
Yeah.
But if you're open, next time. Because I just, there's times I really struggle. Like, I think around April, I was really not okay. The physical symptoms were like
Chaotic.
beaming.
Yeah.
And my mental health was not okay. So everything was just crashing down and I just took a break. I like having fun. I do. But on my own terms.
Yeah.
You can't just call me and tell me randomly because maybe I'm having a bad day.
Yeah.
So I try not to make it my identity. Like I have it, yes, but I'm still this other person. I'm still someone else. And I'll always talk about it. Whenever someone says, oh, I've had my periods for 5 days and it doesn't seem like it's stopping, I'm always on to, able go to the hospital.
So now?
Yeah, because now people don't take it
like
it's a serious thing. But on my socials, I talk about what I'm struggling with. If I can talk about it, I go into details. And if I'm happy, I'm genuinely happy. And I'll be happy with everyone. And I like that you can see I'm happy on my socials.
Absolutely.
The art of
In
pretense.
fact, let me tell you.
But sometimes
keep telling people, don't believe everything you see.
True.
In fact, a lot of us don't look like our problems, to be fair. A lot of people are navigating very tough issues in life, whether it's health or finances or family or whatever else is going on. Just because I'm showing up doesn't mean I'm okay. And so maybe even to the audience, check in with that person that you know is navigating a difficult illness and see how they're doing. Just, hi, I see you. Keep going.
My followers are so nice because I post every day. I post daily affirmations every morning. So if I miss a day,
they check in.
So there's someone who'll come and say, why have you not posted that affirmations today? And then there's someone who'll come and say, are you okay? You've not posted anything today. I'm like, I'm just having a day, but I'm fine. People check in.
That's fantastic because again, building community like that is tough.
It's been years.
Of being loud. No, I love that. And then also the fact that you're educating about PCOS, because I have seen, like in the highlights, I've seen a lot of informative posts where you're describing the condition, you're explaining what it is, you're explaining what symptoms look like, and then treatment options that you should be discussing with your doctor or with your healthcare provider, and then how to advocate for yourself. That for me is like the goal, because I feel like we're still very passive when it comes to our own healthcare in Kenya. And I guess it comes from that God complex approach to a doctor where I sit up here and you sit here and you do exactly what I tell you to do, as opposed to now where you're the one going through it. I need to understand what you're navigating so that I can help with that journey. What are your priorities? Because with PCOS, like I said, depending on what your priority is, treatments will vary. So my first question when someone has a diagnosis is, what's your priority right now? These are the options we have. Pick the one you feel is most important. It's your period.
Really nice. Which is really
Let's
nice.
focus on that.
Because most people assume you just want to have kids.
That
is always the approach, especially at my age. That's the approach. And when I say, okay, maybe like in 2 years they're like, are you sure? You should have kids
have
now.
kids now.
But that's not a priority for me right now.
Right.
Yeah.
Yeah. So I think that holistic approach is something we are still missing in a lot of areas, but something, of course, room for improvement as always. In terms of also, again, in your experience, can we handle patients better?
Yes.
Is there room for improvement?
A lot.
Because I do have a large chunk of the audience who are medical providers in different cadres, whether it's medical doctors, nurses, clinical officers, physiotherapists, and all other sorts of medical providers. What can we do to better?
As you said, you should ask, what is their priority? Don't just assume, just because I'm like 30, I want to have kids. Maybe I just want my periods to be regular. Maybe that's what I want at the moment. Asking what the patient wants is very important. That's what I got from my last guy now. He asked me, what do you want right now? And at the moment, I just wanted, because I am pre-diabetic, at the moment, I just wanted to regulate my sugars, my periods, and my mood swings. So I'm seeing a psychiatrist and a therapist, and I'm also regulating my periods. That was okay for me.
Yeah.
And also not making it look like you're doomed. Because now you'll tell me, now you'll have issues with fertility. You should have a child right now.
At age 20.
Don't take more than 25 years. But that, don't make it seem like it's
now or never. Yeah.
Because now, for me, I was told by 24, if I don't have a child, now that's a problem. I am way past 24 now.
So now what next?
So now,
right.
Yeah. Relaying the information is very important. How you don't have to be like really like supportive like a friend, but you just have to show that you're there in case you have a question. You can always reach out.
Yeah.
Don't just give me the meds and just wish me luck.
True.
Yeah.
True. Yeah.
Because I got that from, I think, when I was 20, 21. I had a new guy now. I don't think he was interested. I think he was busy.
Right.
So he gave me my treatment, and I've never seen him again.
All right.
Yeah.
Okay.
And every time I come and I'm like, now today I am feeling like this.
Yeah.
This is part and parcel of your condition. You will be okay in the long run.
And then, okay.
And then now, yeah.
So better support.
Better support.
Okay.
And it means so much coming from a doctor, because ideally you should know more than I do.
Yeah.
So if you tell me I'm going to be okay, I will believe you. Instead of someone else telling me that because they don't understand what I'm going through.
Right.
Coming from you makes it feel safer. Yeah.
For me, I think I'll add on just to my colleagues, please, there are other options available. We are in 2025.
Yeah.
We can preserve fertility in many ways. We can have you freeze your eggs. We have every option available all the way through, from basic ovulation stimulation when it comes, or induction when it comes to especially PCOS, all the way through to IVF and freezing eggs and coming back and revisiting. So instead of dismissing you to go have children when you're not ready, I should be discussing what your options look like. And I think that would offer better support, right? Any words? Because again, today you're the professor of the topic. Either words of encouragement, advice, something you feel a young lady watching in the audience who's probably just starting this journey. She knows something is wrong. She's scared to death to see a doctor, first of all, or she's gone in and she's received a baseline, this is what you have, take this medication, that's it. And she doesn't understand. And the fear that comes, especially the fear that comes with a big worded diagnosis with no further information. And especially in this age, there's the benefit that there's more information available. There's the negative that there's a lot more misinformation available as well. So any advice you would have to someone in the audience today who may be navigating this diagnosis for themselves for the first time?
I have a lot to say, because the misinformation has gone overboard. I have 14-year-old nieces who I talk to about what I go through, because they don't understand why when I'm on my periods, I'm very inactive. I'm not doing anything. I'm in bed. Everyone is looking after me. They don't understand why it's like this for me and not for everyone else. So I make sure to tell them what it is, how it is for me, why I'm feeling the way I'm feeling. And for anyone who's been diagnosed with it, for now I can say it's not the end. I know so many people with PCOS who have given birth. It might take time, but it will happen. There's so many options. And I'm glad right now there's so many options you can take for like birth and everything. Which I'm also reading about. I'm not so crazy about it, but I'm reading about it. And it's not over. It's not. Also, teaching your men, like your boyfriends, your husbands, about it is very important, because most times people don't understand, why are you like this? Why are you taking long with the birth story? Why are you having your periods? Why are you always taking off days from work when you're having your periods? Don't shy away from telling the truth.
Right.
I am suffering from this. My periods are really bad. I need some days off. Don't shy away, because painful periods are not normal. And I think we are used to we're used to people saying, my cramps are so painful, I can't do anything. But they're not supposed to be as painful as they are when you have PCOS. And you cannot afford to go to work like that. So don't shy away from telling people that you're in pain, from telling people that you're struggling, whether physically or mentally. And see a gyna who is supportive, who wants to know how you're doing. And I think also being on those pills has a long-term effect. I'm not so sure from a medical point of view, but at some point, I feel like doctors should stop giving that and just start dealing with a symptom at a time.
Right.
Because there's, for the facial hair and everything, there's people who take spearmint tea and it works. There's people who take magnesium for sleep and it works. You don't necessarily have to do so many things to help.
Right. So consider the alternative options as well, or even insert supportive options. So if you come in and you have a lot of pain, you're unable to regulate weight, then I work with someone in physio as well as somebody in fitness and nutrition, and we see if we can hold hands and guide you along that. Look at treatment plans outside of just, because again, let me tell you, also I have to defend us.
Yes, you do.
I also have to sit here and be like, I'm also a doctor, guys. The reality of medical training is we were trained, or we continue to be trained on the medicine that is known, on what is fact-based, because it's always evidence-based. So as long as a study has been done, or someone has done a bit of research and has been able to prove that this works versus this, that's what a doctor is going to speak very confidently on. And it's from the medical training. It doesn't mean that there's other things that wouldn't help. It just means that maybe your doctor is limited in terms of that knowledge. Whether we acknowledge it or not is different. It comes on a person-to-person basis. But then with that in mind, then I keep asking that patients should learn to advocate for themselves. And I give the room for that. I can speak for my own practice, because if you come in with a condition and you bring me a binder, you see, Daktari, I Googled and this came up and this. And now, in fact, I love that patient. Because now we sit and we discuss. We discuss and I say this is a myth and this is factual. And then I'll explain, this is why we give you the pill. And this is the effect and this is the long-term things to consider and why it works for what you want it to work for. So that you're not just taking it, not understanding. If we choose a different method, because it's not always just that we'll give you the pill. We also have other hormonal options. If we choose something different, you're factoring in your lifestyle, the ability to remember to use this option, your ability to tolerate the side effects, if any. Again, the goal at this time versus how long, and we're also painting a picture. So yes, this has managed your symptoms. I need to keep reminding you this is a chronic condition. We've not cured anything. This will work up until a certain point. Either you'll have a flare or something worsens in terms of your symptoms and now we have to revisit, or now you change the goal and tell me, now I'm not interested really in fertility issues. I'm looking to just end this journey, because again, at the time where you're looking at menopause, you're not thinking about having more babies, you're done, or you're still suffering so many symptoms, but you don't need to continue with reproduction, or vice versa. I'm now ready to start the fertility journey. What does it look like at my age? What are my options? Should I be thinking about, am I restricted in any way? You've talked about now having pre-diabetes. Also, it has an impact on the treatments that should be available to you versus what we wouldn't recommend. So having a dynamic conversation, an ongoing, because it's a journey.
Yeah.
So that's something I definitely encourage colleagues to do more, while also asking the patients to advocate for yourself. Because if you don't push
Very
us,
important. Yeah.
we're also stuck in our ways. If you don't push us, we were taught by 1970s teachers.
Yeah.
Okay, that's where a lot of our medicine is stuck, and not necessarily the human who taught you. It's the textbooks.
Yeah.
It's the way the explanation is in the books, that this is the condition, this is the treatment, this is your diagnosis, this is the treatment, and then alternatives are listed in fine print at the bottom for others, for the nurse to worry about, for the not for me as the doctor.
Yeah.
So then, with that in mind, if you come in, you need to understand that it's not that you're going to be told
Yeah.
the solution. It's let's hold hands and figure it out. Because I still have a lot of resistance from the patients that way. They come in and they're like, from even just simple things of, I need a contraceptive. So, Daktari, what should I use? I'm like, that's not how that works.
Yeah.
It'll never be that I'm making a decision for you. But if you understand from that lens, I think it should help push people to advocate for themselves more, and to also inform themselves, educate yourself. Ask your doctor, like we said, there's a lot of misinformation. Ask your doctor for references, for the right resources to read on, so that you understand your condition better, but without too much misunderstanding or misinformation. Yeah.
That's also, you could, there's so many support groups. I'm in one. It's a Kenyan based. It's really nice.
Okay. Plug us. That's what we're here for. That's what we're here about.
PCOS Foundation. Yeah, PCOS Foundation. Kenya. Being in the same group with people who go through something you're going through, or something different, something you've read, is eye-opening, because I didn't know this could happen. It's not happening to me, but wow. How are you dealing with it? Having a support group, seeing a psychiatrist and a therapist, because most people with PCOS also have anxiety issues, depression.
Yeah.
It's very important.
Tell us the difference. We are here to inform. You're using, people are hearing you're saying two things, but they know them to be the same.
Oh, anxiety and depression.
No. Psychiatrist and therapist.
Oh, okay.
Yeah, we're very basic. We don't use jargon. Kabisa.
Okay. For me, my psychiatrist is the one who I go in and ask to see a doctor. That's who I'm going to see. He or she is the one who's going to prescribe medication, tell me what I'm suffering from. Now, my therapist is who I talk to, who helps me manage everything, my feelings. And yeah.
I love that. So you would explain this so much better than I would have with my jargons.
So I see both of them from time to time. It's been 7 years of therapy, in and out, because there's times you get to a point and you're like, I think I'm fine. And then months later, you're not fine. You've just been masking everything. Now, for me, I cover everything with everything I'm doing with work, with traveling with. So it's huku.
It's in the back of your mind,
So now when I sit down with it, now that's when I need to talk to someone about it, because you have to, because people don't understand. When I tell you, I'm having a really bad day. What happened? Nothing. I'm just having a bad day. So seeing professional help for your mental health is very important. Whether it's a free session, there's a place where my siblings go for sessions. They don't charge. Whether you can pay for it, it comes in handy. You don't need to be on medication like the antidepressants. You just need to know you're not okay and how to deal with it.
Okay. Finally, because we can talk forever.
Right.
Finally, the negative side. Given everything that you've lived through so far, some of the symptoms you've been having, have you experienced any stigma, any hate, any negativity around having a diagnosis of PCOS? And if so, how have you navigated it? Or if not, then how have you been able to foster a positive support system? Because that's what that's evidence of.
I have experienced a bit of stigma at some point. First in high school. My teachers, they didn't understand.
Your nurse.
My nurse.
There you go.
And then growing up now, talking about it, especially in the dating scene, you get to a point where you're dating for a couple of years, and then you tell them, this is what I have. It's a fertility issue. Then they're like, I don't want this. I don't
Yeah.
want.
Yeah.
I've had that happen to me.
Right.
And what has helped me navigate, because I've even like on Instagram, there's people who think it's not much of a big deal.
Yeah.
It is.
Yeah.
So they'll try and water down everything I'm saying. When I am telling people about how I'm struggling with my cramps, they're like, everyone has cramps, but
yeah,
you
there's
don't
a lot
know,
of people
like you don't know what I'm
minimizing
talking
symptoms.
about. Yeah.
Yeah.
But how I navigate it, I have a really good support system. My family, my friends. My best friend is a doctor. So I can talk about it without feeling any embarrassment or it's been easy because of the people that are around me, because they care, they ask, they take me for my sessions. They, if I need anything for my diet, they offer to buy. It's easier now as compared to like 5 years ago, because now I couldn't get to a point with a man without them worrying, what if we get married and now this,
and then this becomes
which is a possibility, but now you don't have to make it seem like I'm a
damaged.
person,
Damaged
like I'm
goods.
damaged.
Yeah.
So I've faced it with men mostly. Mostly it's with men, because women understand. They want to know, like, what is this you're going through? Can I talk to someone? I had someone else saying they're going through this. Can I tell them about you? But with men, most of them don't understand, so they'll try and women go through this all the time. You'll be fine.
Yeah.
So now I have daily affirmations every day for myself. I'm very confident. Yeah, so I tell myself,
I love that.
I'm okay.
Yeah.
Even if you think I'm not okay, I'm okay. I'm still showing up every day. Even when I'm not, I'll still show up. So it's better now.
Okay.
Yeah.
Okay.
Yeah.
Okay. So first, finally, last, last, it's thank you for coming on set, being brave enough, because I think, again, living with a chronic condition and then being brave and bold enough to talk about it, especially so knowing that there are people who will receive it with negativity and hate and try and minimize your experience. I think that's already such a bold step. I'll direct the audience to find you on socials. As always, I'll put everything in the description or in the caption, on socials as well as on YouTube or Spotify, if that's where you find us. And the main thing for me, the main takeaway is you can live as normal a life as you choose to, despite the odds. So thank you so much for sharing your journey with us. I hope this wasn't too traumatic an experience for you.
No.
Okay.
Thank you so much for having me.
No, absolutely. So then, to the audience, if you've managed to make it to the end of this episode, if this is something you'd want to see us talk about some more, maybe I can convince Nanjie to join me on socials. Maybe we'll see. So that if you have any questions, please continue the conversation on the comments, the DMs, the email. Everything is usually linked in the description or in the caption or in the link kwa bio, surely. I keep saying, see link kwa bio. It's the one at the top up there. And reach out if you have further questions, if you want to continue engaging, if you're experiencing something similar, share your story. We're here and we're happy to continue to engage. For now, thank you for being with us, and I'll see you on the next one.